The last part of the physical exam will be palpation, and the reason we do this last is that sometimes if you palpate the abdomen first, it can kind of upset whatever is going on in the stomach. So it's best to look and listen first before you go poking around, as you might say. So you're going to begin with light palpation, and you're going to do that in all 4 quadrants of the abdomen, starting at the right lower. You're basically going to use your fingertips of your dominant hand, and you're going to go in a rotating motion, pressing down about 1 to 2 centimeters. And you're observing for any pain or masses. Pay special attention to any nonverbal or involuntary signs of pain. Patients that you shouldn't use palpation on is anyone who's had an organ transplant, as a lot of times when they go through that, the transplanted organ is placed more anteriorly than the original organ, and it has less protection then. And also, you should never palpate a child who you suspect of having a Wilms tumor, because that could cause seeding of the tumor into the abdomen. If the patient is exhibiting involuntary guarding of any area, it could indicate peritoneal inflammation. After that, you're going to do deep palpation, which is basically the same, except you're going to depress about 4 to 6 centimeters, and you're going to do that in each quadrant of the abdomen, and you're going to be using a rotating motion of your fingers. If the patient has an abnormally large abdomen, you may need to use 2 hands, and again, doing that in all 4 quadrants. So to palpate the liver, you are going to take the, since I'm right-handed, I'll be standing on the patient's right side for all of the palpation assessments for the liver, spleen, kidneys, and bladder. You're going to take the right hand and place it at the right midclavicular line under the costal margin, and then the left hand is going to go under the patient's back at the level of about the 11th or 12th rib. Then I'm going to press up with my right hand while the patient takes a breath, and I should be able to feel the bottom edge of the liver while they inhale. An enlarged liver will be palpable before they inhale, and it'll be palpable below the edge of the costal margin. A second method is the hook method, in which you hook both hands under the costal margin and feel the edge of the liver when the patient takes in a deep breath. Next, I'm going to palpate the spleen, and since I'm right-handed, I'm going to stay on the patient's right side. So I'm going to place my left hand under the left CNA and pull my left hand up to bring the spleen to the anterior part of the abdomen towards me. Then I'm going to place my right hand under their left costal margin and press in while the patient exhales. You should not be able to palpate the spleen. It's abnormal if you do. It would indicate splenomegaly, and you would see that in different disease processes like mono, HIV, any sort of metastatic cancer of the liver, or of the patients with sickle cell could have splenomegaly. Next, I'm going to palpate the left kidney. So I'm going to take my left hand and place it on the left CVA, and then place my right hand on the costal margin and capture the kidney between my 2 hands while the patient inhales. And I'll do the same on the right. While they inhale, you will then be able to palpate the kidney with your right hand when it's been captured between the 2 hands. The right kidney is normally not palpable unless it is enlarged, and the left kidney may only be palpable in slender patients. Enlargement of the kidneys could indicate hydronephrosis. Next, I'm going to palpate the abdominal aorta, and again, the patient's going to be laying for all these assessments. I'm going to take the fingertips of both of my hands and place them at the epigastric region, just slightly to the left of the midclavicular line. And both of my hands are going to be placed about 2 centimeters apart, and I'm feeling for abdominal aortic pulsations. if the aorta is greater than 3 centimeters, or if I'm feeling lateral pulsations, that could indicate a AAA, an abdominal aortic aneurysm. And then finally, I'm going to palpate the bladder, and for that, you use deep palpation, and that's the hypogastric area near the pubic symphysis. So again, using deep palpation, going in about 4 to 6 centimeters, and if that's tender, it indicates that the patient either has a full bladder, there could be a mass, or possibly a urinary tract infection.